محمد وآل محمد.
اللهم صل على محمد وآل محمد.
بسم الله الرحمن الرحيم. Prophet Muhammad sallallahu alayhi wa sallam was quoted as saying, there are two blessings which many people waste, and that is health and free time. Assalamu alaikum everybody, and thank you for allowing me the time to speak to you today about the Islamic Institute of America's newest initiative, the Faith Community Health Initiative, under the spiritual guidance of our dearest Imam Sayyid Hassan al-Kazwini. What started as an idea when our dearest Haji Najah Bazzi was exposed to what was originally known as parish nursing in the 1970s, led to her being part of a transcultural movement to include more people in that field. Haji Najah reconnected with the Faith Community Nursing Network at Henry Ford Hospital, where in 2017, her and I got our Faith Community Nursing certification. Two of the first Muslims in the country to receive that certification. The foundation of this office is rooted in the Faith Community Nursing model that many Christian churches have implemented for many centuries. And here we are today, establishing the first Muslim Faith Community Health Office in the country. We are going to be addressing physical and mental health topics from an Islamic perspective. Faith Community Nursing focuses on the intentional care of the spirit, as well as the promotion of holistic health, prevention or minimization of illness within the context of a faith community. Research conducted by the National Institute of Health and academic institutions such as Harvard establish a positive relationship between spiritual practices and health. As many of us know that when illness or tragedy befalls us, our families, or our community, we turn to the source of spiritual strength for reassurance, support, and healing. With this connected relationship of health and spirit, we felt the importance of establishing this office to help create the model for other Muslim faith community offices around the country. Under the mentorship of Haji Najah, this team of multidisciplinary health professionals came together. We discussed the highest needs and created multiple tracks to meet those needs. Mental health, as many of you know, was at the top of our list. With the opiate epidemic, substance abuse disorders, other mental health issues like suicide and depression affecting society as a whole, but the Muslim community has not been exempt from these challenges. With the mental health track, we will discuss, educate, and support these challenges and taboo topics. Dr. Shadi Shabak will be leading this track. Dr. Shadi has completed his undergraduate studies at the University of Michigan in Dearborn in 2008, where he graduated with a bachelor's in psychology and a minor's in biology. He attended medical school at the American University of the Caribbean and received his Doctor of Medicine degree in 2013. He completed his general psychiatry residency from Virginia Tech School of Medicine with a focus on adolescents and young adults. He began working on his master's in education for health professionals with the Hopkins School of Education while completing his general residency. And he pursued curriculum building and narrative learning theory. Currently, he's an attending psychiatrist at Pine Rest Christian Mental Health Services, working primarily with adolescents and emerging adults. He's also a clinical professor of psychiatry through Michigan State University. And he's also the founder of MOVE, Movement for Outreach, Volunteerism, Education, a nonprofit dedicated to expanding the bio-psycho-socio-spiritual integrative model of health. And Dr. Shadi has also opened up a mental health clinic in Dearborn to better service the Arab and Muslim community. A second track is going to be our aging, chronic illness, and end-of-life track. We will be bringing leading experts to help educate the community about illness management, caring for our elderly and aging population, our parents, and dealing with the end-of-life ethical issues and the grief that may follow. Under the leadership of Hajj Najah and her vast experience of end-of-life issues, we will be addressing these topics. And we all know that Hajj Najah does not need an introduction today.
Dr. Shadi.
Sorry. That's me, I'm Doctor.
A core tenet of faith community health is wellness and prevention. Islam is rooted in prevention, which isn't only for Islamic practices, but also stems to our daily lifestyle choices in health. The wellness and prevention track will focus on topics such as parent and child bonding, social media use, vaccines, and much more to educate the congregation on healthy lifestyle choices and preventable challenges. Lama Hassoun Ayub will be leading this track. Lama has over 10 years of experience in program development and research, both in the US and the Arab world. She has a master's in public health from Harvard University. She's also currently a senior fellow from a nonprofit organization based in New York City, while also teaching psychology to undergrads at Wayne State University while she gets her doctorate degree in developmental psychology. Her interests lie in wellness, prevention, and youth programs. Sister Lama. We also have a wonderful team of committee members. Haji Shadi Hamka, who's an oncology nurse. Haji Ali Alawiye, who is a new nurse interested in home health care. We have Ahmad Awada, a first-year medical student at Oakland University's William Beaumont Medical School, who has a huge passion for education. And we have some sisters, Sister Suda and Yasmin, who are mental health providers, who work for local social service agencies, and they have a huge interest in culturally sensitive mental health therapy. A little bit about me. I'm a master's prepared nurse, working as a pediatric nurse practitioner for Henry Ford Health System in the pediatric school-based and community health department. We service Detroit public schools and provide better access to healthcare services. When I was a student doing my clinical rotation, one of my rotations was a school-based health center. And I thought to myself, what a great idea that we are going to the students and the patients instead of them coming to us. And that is what brought me here today. We are coming to the Islamic Institute of America and surrounding community and providing some needed education that collectively as a community would be better than the sum of its parts. With multiple tracks, we are providing something for everyone. We welcome thoughts and suggestions. We are bringing together faith and well-being and growing a strong, healthy community. It is quoted in the Quran, Bismillah ar-Rahman ar-Rahim, everything good that happens to you, O man, is from God. Everything bad that happens to you is from your own actions. Chapter 4, verse 79. Let's take action and not waste our health. Thank you for giving me the time to speak today. If you want to contact us, you can reach us at fchi@iia.org. You can speak to any of the committee members. And thank you so much, and Assalamu alaikum. Yes.